righteousness. We thank you for the opportunity today to gather here, even as our professionals are leading and helping us to keep healthy and to, even if anything is not gone well in our lives, to find solutions to. We want to thank you for every aspect of this meeting today, the morning session, the afternoon sessions. We want to bless you for the lives of all those who are gathered here, as well as those who are on their way to this venue. We know that all will be done for your own glory. We pray that the skills and the wisdom of our professionals will be sharpened, and that whatever that ought to be done amongst your people and our communities and the nations will be done for your own name's sake. We thank you, we bless you, because you know you are with us and we will excel. And by the close of the day, everyone will go from here excited and rejoicing in you. May your name be praised now and forevermore. In Jesus' mighty name we pray. Amen. Amen.
Thank you so much, Pastor Alex, for such a short prayer. So guys, welcome once more. And I just want to give a very quick whistle tour of the day, and also about CHPNet and why we're doing what we're doing. It set the tone and it give you clarity as to why you are volunteering your 5.5, 6 hours this morning, okay? So before we start, we just want to quickly acknowledge some people in the house who have been so supportive and have been helpful to us. I wouldn't name by name, but we have our area head among us and the wife. We also have our national head with us. Okay, so if they can just give us a wave, okay, please, they are in our midst. Okay, Dr. Lord Donko is with us. Okay, area head is over there. Okay, with us. Okay, so I wouldn't call names because we do know time will fly quick. And also the executives and the volunteers, please give us a wave wherever you are. The guest speakers who are coming from everywhere: kidney health, breast cancer screening, prostate cancer UK, diabetes UK and stuff. Please give us a wave. And the executive team, just give us a wave wherever you are. Okay, we give you a wave. And we do have some dignitaries coming in as well at the latter part of the day, or even some maybe here now. We have the mayor of Dagenham and Ranham. I think they are with us here. And we have the PCC of those two areas as well with us. Okay, God bless you so much for your time and being present here today. So why are we here? We are here because health is wealth. We are here because without the right knowledge, you can perish. We are here because you only have one vehicle to drive through this experience called life, and that vehicle is good health, and that vehicle is your body. And it is vital that that body is looked after, that body is attended to for you to have longevity to drive through the experience called life. And to do that, God has been faithful that he gave birth to an organization called Christian Healthcare Professional Network UK. And who are we and why are we here? So we were formed roughly going to about 3 years now, during the height of COVID, when everybody was looking for a solution, everybody was searching for answers to their problems. We were formed. And we were formed with 3 main reasons, which then became our motto. We were formed to connect, we were formed to transform, and we were formed to impact lives in our communities, in our countries, in the world, okay? And one of that third initiative is why you are here today. So what exactly is this network? We aim to, where possible, to create a platform for all Christians who are healthcare professionals to amalgamate together, to be able to share ideas, to network with one another, and also to support one another, be it through career development, be it through the Christian to Christian professional and spiritual well-being and support, be it through providing the resource that our communities need, be it through providing that platform for our younger people who are on their journey to become doctors, nurses, pharmacists, dietitian, you name it, to be able to have that pathway where they can go to somebody to get the right vibe, the right support and information that will take them to the next destination. So that is why we are here. But we do understand that nobody is an island of their own. You live in an interconnected world. And to do this, it's important that the network is felt, is seen, and is valued in the community. And therefore, with the leadership of the network and also with the support of the church, came the initiative, which is hosted by London North under the flag bearer of the Apostle George Crunchy, who is the boss in this patch, okay? So this is why we are here today. What would we do? We are going to flow through the day in this way. Everybody will come through the front door. On your immediate sitting area called the landing bay, we have volunteers there. They will register you. So make sure you scan your QR code if it's not working. We have a laptop. Put your name, your details, and stuff. This is important. We don't need it to pass you on to any sales company. We need it so that if we picked up something with your screening, those information can be channeled to your healthcare providers, i.e. your GPs, okay? So your name and details you are given is not that we will pass it on to a salesperson or we, by default, make you a member of the church. No, that's not what we're doing. So please don't fear that. Do that. And then once you walk through the door, there are a few tables set in this order. So we have the kidney screening team at the back. We have the blood pressure screening team at the back. We have the breast screening and awareness team at the back. We do have the prostate screening team on the side. We have the mental health screening on this side. And to the side of the booth where the engineers are, we have our blood glucose screening team over there. We do have a room for breast examination, which is straight in front of me between these two doors. So if something you are concerned with, maybe you are worried about a lump, something changes to your breast that you want to be examined, we do have the expert here. These are people that you see every day at work. The only difference is they are wearing their house clothes or they are wearing the CHP logo. So they are the same professional, the same person you see every day, but just in a different clothing. So don't worry, they are expert. They will be able to support you and get those examined. And once we picked up anything from your screening with your consent, we'll be able to share the information appropriately. We do have some housekeeping rules. If the fire drill or the fire alarm is to go up, there isn't any plan for today. You go through that door, that door, that door, or that door. Where the green man running is, that's the door you want to go through. And once you have your screening, we don't want too many people going through that exit. It will clock the door. You just need to go through the door right in front of me. That will be open, and you can make your way out. Now, we do understand that some people will come here where the issue is not to do with physical health. There is a spiritual dimension to our being because we are a soul. We have a soul, we have a spirit, and we have a body. So there is a provision for that. People who want some spiritual counseling that pertain to biblical faith, there is a room for that. And those who want mental health counseling as well, there is a provision for those as well. So guys, you are spoiled. You have the room for everything that you need at this place today, and we will do those. Thank you for that. Can we give a round of applause to that if you're happy? Thank you. Okay. So in the house today, we have 4 main speakers, okay, who will be taking us through their relevant speeches. Please, I urge all our speakers to stick to roughly a 10-minute slot. This 10-minute, guys, is for them to give you an awareness about the health issue in question. So if it's diabetes, they will talk to you about what it is, why it happened, and give you a little bit more of a health education. And then after which, when you do go to the table, you will be given a targeted, a more personalized, in-depth information that pertain you. So please bear that in mind. So I please urge our speakers to stick to the time so we will be able to get through a lot. We have prostate cancer awareness for speakers in the house, and they are from Public Health in Hertfordshire. I am conscious, though, that he's not here yet because he's in Stevenage, but we do have somebody who will slot in for him, and that person is in the person of Elder Daniel Akapo. Okay? So please, let's give a round of applause to him if he's here. Even if he's not here, please give a round of applause. Thank you. We have Kidney Research / Kidney Care UK, who are from King's College. So if Rosalind Ajekum is in the house, please, Rosalind, give us a wave. She's at the back. The lady in the creamy top. Please, thank you, Rosalind, for coming. We have Diabetes Screening Health in the house, and that is Kiara Okiriki. Kiara Okiriki, please give us a wave so we can know who you are. Thank you. And we do have breast cancer screening in the house, and that person is Doris Botawani. Doris, give us a wave. She's right on that podium where the whole banner is. Thank you, thank you. And we also have one of our nutrition coach who you will find in that entrance. She will talk to you about healthy diet, eat right, eat the right thing in the right place and at the right time. And that's in the person of Verilyn Guinea. Verilyn, where are you? Give Verilyn a clap. Thank you. So we will call our speakers now. It's their turn to tell us what they are here for. And the first person I've got on my list is from the Kidney Research and Kidney Care UK. And that's in the person of Rosalind Ajekum. Sister Rosalind, we welcome you. Thank you so much.
I am so pleased to be here. My name is Rosalind. I work at King's Kidney Care, and today I am here with what we call kidney health ambassadors. So what is our main vision? Our main vision is for kidney disease to end with us. We don't want people to develop kidney disease. Now, when we talk about kidneys, people would ask, Rosalind, what are kidneys and why should I worry about kidneys? Our kidneys are an amazing organs in our body. All of us have two. And I'm going to be very controversial here. All of us have two. One is what I call the gift of life. So that is what I mean, but I'm going to be controversial. We can all live with one. And when we transplant somebody with a kidney, we only give them one. Occasionally, we may give them two from somebody else. But we can all live with one kidneys. So what exactly do our kidneys do? First, let me talk about how the kidneys and the heart work together. Our kidneys and our heart work together to regulate or control our blood pressure. What that means is that if somebody has blood pressure or high blood pressure, as we call it, there is the likelihood that that person may develop poor kidney health. It doesn't mean that the person will develop kidney disease, but that person is at risk of their kidney function going down because of the high blood pressure. So my kidneys and my heart work together to ensure that my heart is working very well. That is the first thing. This morning, some of us may have had the opportunity of eating. Every food we take in goes into our body. It will go into our stomach. Our stomach would digest that food. But the kidney is responsible for getting rid of what we call waste from the food I have eaten. Even the water that I drink, my kidney is responsible for ensuring that the body takes the water that it needs, and the rest that I don't need, it comes out in my urine. Water is very important. And without water, I will not be able to move. I will not be able to talk. My eyes will not be able to roll around. But I need my kidneys to make sure that my body can keep the water that it needs inside me, and the rest that it doesn't need, it needs to come out in my urine. What else does the kidney do? I need strong bones and teeth. So my kidneys help my body to actually absorb calcium, which helps in making my bones stronger. Not only that, my heart also needs calcium, and my muscles need calcium for me to move. Okay, that is what the kidney does. Now, something else the kidney does that we call it the waste bin. So I've talked about every food that we eat, but every medication also that we take in, the body will take what it needs from that medicine. My liver will do its work, but the kidney is responsible for getting rid of the rest of the medication. Why is kidney health important? Kidney health is important because once the kidney function starts going down, it does not show any sign at all. Majority of people who come to our clinic never knew that they had kidney problems, not at all. It doesn't show. It takes a long time, sometimes until about 70% of the kidney function is lost before people start realizing that they have any problem. And people will not go to the GP thinking that they have a kidney problem. They go with something completely different, only to be told your kidneys are not working. My kidneys, I feel fine. And that is the danger living with kidney disease. I'm so pleased that I have one patient with me here today. But that is the danger of living with kidney disease. We would never know that our kidneys are not functioning very well. Well, what can I do to actually promote kidney health? I think that is the most important thing. What can I do to promote my own kidney health? First of all, is my diet. And when I talk about diet in three main things. What do I have on my plate? How much is on my plate? What time am I eating? And when you come and have your kidney health check done, we will give you personalized information as it relates to you, because we will not have time to talk about everything in relation to diet. So diet is number one. Number two, physical activity. Keep the body moving. As we keep our bodies moving, it keeps our heart functioning very well. It also keeps our kidneys also functioning very well. Okay. Number three, it is about some of us already have existing medical conditions. The two common ones are high blood pressure or hypertension, as a lot of people know it, and then diabetes. These two conditions are the ones that mostly lead people to develop poor kidney health. So we'll be given medications for us to take. Please, let's take our medications. And if it doesn't work for us, speak to your GP. Let's let our GP know this medication doesn't work for me, and hence our GPs would work with us and change it, or sometimes change the dose that they are giving us or give us an alternative. So please, I urge all of you, what else can we do? Get kidney health screening. That is why we are at the back there. And we don't use blood to check kidney health. We only use urine. Our urine, as I mentioned, tells a lot of how our kidneys are functioning. So please take this opportunity. We will check your weight, we will check your height, we will check your blood pressure, and then we would ask you to give us a sample of your urine. And what are we looking for in that urine? There is a particular protein that is not meant to be in the urine, and that is what we are looking for. And if we find that protein in your urine, we will work with you and your GP to ensure that your kidney health is maintained. Thank you very much.
Thank you, Rosalind. Guys, let's give a big warm applause to her. She's done so well. The first speaker is on time, so I'm relieved. My task is done. Thank you, Rosalind. So guys, further information, speak to Rosalind. Thank you. So we move on next to our next speaker in the house, and that person is Kiera Okiriki. And Kiera will give us a short talk on diabetes screening and what to look out for. Thank you, Kiera. Let's give her a round of applause.
Hello, everyone. Good morning. Just waiting for the presentation. Thank you so much. Yes, my name is Chiara, and today I'm here representing, as a volunteer, representing Diabetes UK. Sorry in advance because I'm a little bit nervous since it's my first presentation, but I hope I can deliver successfully. So, yes, today we will be talking about diabetes. And next, please. we'll be talking about what diabetes is, how diabetes affects people's lives, and also how Diabetes UK helps, and what can we do as a community. Next, please. So I would like to guess, what do you know about diabetes? So basically, diabetes is a chronic metabolic condition characterized by abnormal high level of glucose in the body. But then what is diabetes and why does it happen? This happens because the pancreas, which is an organ situated in the upper abdomen, does not produce enough insulin, or the insulin produced does not work properly. So at this point, what is insulin? Insulin is an hormone that, in fact, has the function to regulate the levels of glucose in the body. So if we don't have enough insulin, or the insulin doesn't work properly, it's difficult to manage and regulate the quantity of glucose in the bloodstream. So, thank you. There are two main forms of diabetes, and these are type 2, which covers for the 90% of all cases of diabetes, and also type 1, which covers around 8 and 10% of all the cases. We also have other rare forms of diabetes, which covers for less than 2%. And these, for example, are gestational diabetes, which is the diabetes that affect pregnant women. So, type 1 diabetes is an autoimmune condition, which means that our body, the body of a person affected with diabetes, attacks and destroys its own insulin-producing cell, resulting in lack of insulin. Usually, these forms of diabetes is diagnosed in young people, and as a pretty much quick onset. So that's why it's diagnosed earlier. Type 2 diabetes, instead, is a little bit more complex because as a slower onset, and in fact is diagnosed usually later in life. And what happens in type 2 diabetes is that insulin might be produced, but it's not enough, or it doesn't work properly. So these slides summarize what has been said, but I really want to stress the attention on the fact that in type 1 diabetes, genetics can play a small part. So family history is important as well. And I said as a quick concept. And also type 1 diabetes doesn't have anything to do with obesity or being overweight. Type 2 diabetes instead, as we can see, has many risk factors, as a slow onset. Oh, I'm so sorry for that. As a slow onset, and also physical activity and diet can have a major impact on diabetes management. Next, please. So here we have a representation of the risk factors for type 2 diabetes, and age, for example, in particular. As the age increase, also the risk of diabetes increase. And particularly over the age of 40 in Caucasian people, and over the age of 25 in African, Black African, Caribbean, and also South Asian people. So unfortunately, we have increased risk of diabetes. Also, as I said, family history, high blood pressure, weight, and also waist circumference can be a risk factor. For waist circumference, it is meant that there's an increased risk of diabetes for people that have most of the weight distributed around the waistline. Next, please. And these are just other risk factors that might contribute to raise the risk. So let's talk about the symptoms. Okay. Often people with diabetes may have the need to urinate more often. And this is because the body is trying to get rid of the excessive sugar in the blood. This also means that, this also means, the other one. This also means that they might feel very thirsty. They might feel tired because of the energy imbalance. And also weight loss is also another sign. Other symptoms might be genital irritation, slow healing of wounds and cuts. And these two reasons is because the sugar accumulates in vulnerable regions where obviously being vulnerable the regions can also attract accumulation of bacteria or fungi. And blurred vision as well, because the sugar accumulates also on the lenses of the eyes, causing visual impairment. Next, please. So diabetic ketoacidosis is a very, very serious condition which can potentially be life-threatening. But what is diabetic ketoacidosis? This condition is caused by the accumulation of acids in the blood. And this happens because when a person has diabetes and its own body really needs energy, we said that we have high levels of glucose in the body. However, that glucose cannot be used because we don't have insulin. So in that case, the body is going to require energy and it's going to request it from fats. However, the metabolism of fats causes release of oxidative chemical compounds known as ketones. And because we use these fats, then an accumulation of ketones is going to result, causing the blood to be very acidic. So the symptoms for diabetic ketoacidosis are almost the same of the other forms of diabetes, but are much more intensified. Next, please. So these slides show the incidence of diabetes based on ethnicity. And as I said before, we can see that there is a high incidence in the South Asian community. So how is living with diabetes? So diet is very important, and people with diabetes require to control diet, which this can mean maybe counting carbohydrates or reducing certain types of foods, or even preferring fruits with less sugar. But however, what is important to understand is that there is no such diet scheme that applies to everyone, okay? So even two people with the same forms of diabetes, they must be considered and treated as two different persons. That's why a person-centered approach in medicine is really important. But we've got in the room many healthcare professionals that will be able to tell you to talk about that. Please. Also, doing physical activity is very important. And for adults, for example, 2.5 hours of moderate activity, or even 75 minutes or much more vigorous activity can be really helpful and can have major positive impact in diabetes management. So here are all checks, routine checks, tests, and services that should be available to people with diabetes. And I really want to stress about services such as mental health and emotional support, because there's something real as diabetes stigma, and these affect 9 to 10 people living with diabetes. Also, half of the people with diabetes often feel alone and experience loneliness or isolation. And 2/3 of people with diabetes, research says they hide their condition to family, friends, and even colleagues. So this is a very important slide about complications. So unchecked or untreated diabetes can lead to very serious complications. We can talk about retinopathy, which is the accumulation of sugar in the lenses of the eyes, and as I said before, can lead to impaired vision. We can talk about cardiovascular disease, heart attack, stroke. We can talk about nephropathy. Nephropathy is when the kidneys are damaged. Then we've got neuropathy, which is the damage goes to the nerves of the limbs. And this can sometimes lead to amputation. And also with food problems. It is known that diabetes can cause foot amputation, and this is because the foot can get ulcerated, infected, and wounded. And in order to prevent, to let the infection spread to bones and near tissues, amputation is needed. So this is why raising awareness and educating the community is really important. And another reason why awareness is important is because diabetes is often misunderstood. Diabetes and all the other forms are misunderstood. And sometimes people with specific forms of diabetes get misdiagnosed. And misdiagnosis has important effects on treatment. And obviously, the person won't get an effective treatment for his condition. So how Diabetes UK helps? So Diabetes UK is a leading charity, and currently there are over 5 million people living with diabetes in the UK. And our vision is to make sure that we move as fast as diabetes, because we have seen that diabetes is a growing public health issue in our society. So we aim to move fast as diabetes. Next, please. So I'm new to my hand. Our aims are actually new treatment, better treatment, remission from type 2 diabetes. We also aim to guarantee quality of care and also seeing less people diagnosed with type 2 diabetes. And also, as a final aim, is to guarantee the certainty that people can live healthy and full, happy lives. So you can get involved with our charity by volunteering, fundraising, or even participating in research, and also joining communities, and also campaign with Diabetes UK. I'm going to end my presentation here. Thank you so much for listening.
Thank you so much. Thank you, Kiara. Thank you, Kiara. Guys, let's give it up to Kiara. Thank you. So further information, please speak to her when you reach her station. So our next speaker, please, let's give a warm welcome to Doris Butawan. Doris is our breast cancer awareness specialist all the way from InHealth. Doris, the floor is yours. Please, 10 minutes.
Thank you, Anthony. Good morning, everyone. My name is Doris. I'm the lead breast care nurse specialist for the breast screening in outer Northeast London. I work for InHealth and we're commissioned to run the NHS breast screening program. So, right, okay. Is there a way for me to control the slides or someone will just do it for me? Okay. So the aims of the session is to improve understanding of breast cancer, know the signs and symptoms of breast cancer, know the causes of breast cancer and how you can reduce your risk, understand the importance of breast screening and early detection, and know the importance of breast awareness and how to self-check. Okay, so first, what is breast cancer? So breast cancer is the collective term for all the cancers that originate within the breast tissue. So cells, our cells normally multiply in a regular, orderly manner. Okay, our cells die and then it gets replaced. But sometimes they do change and begin to grow and divide in an irregular and uncontrolled way. And that's how the lump is formed, okay? So breast cancer is the most common cancer in the UK. It is now said that 1 out of 7 ladies are bound to develop breast cancer. Around 55,000 women and almost 400 men, yes, it also happens in men, are diagnosed with breast cancer every year here in the UK. And around 1,000 women in the UK die from breast cancer every month. That's every month. However, more and more women are surviving thanks to better screening and better treatment and also better awareness. Okay, so now what causes breast cancer? There's really no single reason that we can pinpoint that causes breast cancer, but it is believed to be caused by a combination of factors like our genetics, our age, our sex, our lifestyle, choices, diet, and surrounding environment, okay? But one of the biggest risk factors is increasing age. So it is common in older women. At least 4 out of 5 breast cancers occur in women over 50. In a small number of cases, breast cancer runs in the family. So the type of breast cancer that runs in the family only accounts for about 5% of the whole breast cancer diagnosis. So can we reduce our risk? Yes, there are something that we can do in order to reduce our risk of developing breast cancer. So making small healthy changes, such as being drink aware, okay? Maintaining a healthy weight, because breast cancer is more common in like obese and heavy-weighted ladies. Eating healthy, okay, and staying physically active. So it is important that we keep ourselves active. The recommendation is that we do at least half an hour every day of moderate activity. So these are activities that are enough to make your pulse rate go faster, okay? And the recommendation is to at least do it 5 days out of the 7 days, 5 days each week. Okay, so now why is breast screening important? Breast screening is important because, like I said, early detection saves lives. Okay, the way breast screening works is that a lady, when they turn 50, they automatically get invited to breast screening. So you will receive an appointment. And it is important that once you receive that appointment that you do attend, because there's a screening round, we call it. So we cover the whole outer Northeast London. So we will begin to invite ladies from 50 to 71-year-old from each borough, and then we move around. And by the end of the third year, we go back to where we started. So if you missed your appointment, you will not get invited until the third year, until we're back to your area. Does that make sense? Yeah? So we have different screening locations, and we do move around, like I said. We have two static locations, one in Hornchurch, one in Romford, and we have a couple of mobile vans that move around in the borough, from Wanstead, Woodford, Barking, Dagenham. Currently, we have one in Ilford, in Redbridge. Okay, so why breast screening? Like I said, it is because breast cancer is the most common type of cancer in the UK. Then it's important that we do attend our screening. Okay, and again, I cannot emphasize enough the importance of detecting it early. So if you are not of screening age yet, that means you're before 50, it's very important that you're examining yourself. And if you notice any changes, that you go to the GP and get checked, okay? Because the earlier the breast cancer is diagnosed, the better chances you have at beating it, okay? Right, I'll move to what is mammogram. So I'll ask the media people to just keep up with me. What is mammogram? So we screen by doing a breast x-ray of your breast, and that is called mammogram, okay? And the way we do mammogram when you come to your breast screening, sadly, or I shouldn't say sadly, up until this point, the machine that we use for getting an x-ray of the mammogram is a big picture. I think we can go to that one. Is the picture of the mammogram machine. So where your breast is compressed between two plates, up until someone brilliant invents a machine where we can take x-ray of the breast without compressing it. I hope I still live to see that day. But at the moment, we use this machine where your breast is compressed between two plates, okay? It can be quite uncomfortable, yes, but it is important. It's the only way we can get a good picture of the breast. So when you go to your screening mammogram, they take two pictures, one from top to bottom and one from side to side where it is compressed, okay? And next slide is a picture of how an x-ray of the breast looks like, and that this is how we pick up abnormalities when you go to your screening, okay? But like I said, in between your screening, because we only screen ladies once every 3 years between the ages of 50 to 71. Before you reach the screening age, and even when you're already screening, like I said, it's once every 3 years, it is important that all of us are checking ourselves, even men, because I mentioned earlier, breast cancer also happens in men. So just being breast aware. So how do you become breast aware? It simply means knowing what is normal for you. And you get to know what's normal for you if you're checking regularly. Recommendation is to check at least once a month. So you check by looking and by feeling it. So we call it TLC, touch, look, and check, okay? TLC, so remember that. So like I said, for ladies, the best time to check if you're still getting your period is about a week after your period, okay? That's the best time to check. So how do you check your breast? Okay, you check your whole breast, so not just the breast, but you have to include the side, the armpit, right up to the collarbone. Like I said, you check by looking and by feeling. So what are you checking for? Any lumps or bumps, any swelling in the breast, the armpit, or the upper part here in the collarbone, okay? You also check for changes in the skin texture, like dimpling, puckering, or changes in the appearance of the skin around your breast. Changes in color of the breast, especially if it looks red and inflamed, do get them checked, okay? The other thing that you look for is changes to the nipple area, especially once it starts to go inward. An inverted nipple is a sign, because when there's something growing inside, it tends to pull the nipple in. The next one is any discharges coming out from the breast, especially if it's dark colored or blood stained. If it's clear or milky, we're not too worried. You also check for rashes and crusting around the nipple area. Any changes to the shape and size, if you notice any distortion, the rule of thumb is any change, you should really get it checked, okay? So in conclusion, know your breast. All you need to remember, like I said, is TLC, touch, look, and check. If you notice changes, make sure you go to the GP and get checked. Do not delay, or do not wait for your breast screening, because like I said, we call you once every 3 years. So in summary, know your breast, touch, look, and check. Know what changes to look for. Report any changes to your GP without delay. And once you get invited, when you turn 50, make sure you don't miss your appointment. Do get checked. Okay? Next slide is just my resources and my contact number. And I have a stall there at the back. If you have any question and you want some leaflet, do go and see me later on.
Thank you so much. Thank you, Doris. Thank you. Guys, give Doris a round of applause. Thank you for being on time. Thank you. So TLC. Okay, TLC, touch, look, and check. So we have our final speaker in the house, and then after which we will now go to the back at the store. And that person will give us an awareness on prostate cancer. We look after the men, we look after the women, sorry. Let's now look after the men. So I will call Dr. Kingsley Appiah. Please, the floor is yours and the microphone is yours. Please deliver your session. Thank you.
Hello, everyone. Hello, everyone.
Hi.
Hi. My name is Kingsley. I'm a practicing GP in Hertfordshire. I'm also one of the CHP net reps for London North area. The slides will come on very soon, but I'm here to essentially talk about prostate awareness. Prostate is a gland that all men have, okay? And one of the very interesting things about the prostate is some people think about the prostate only being an issue if it's cancerous, but the prostate can have a lot of other things going wrong with it. If we can have the next slide, please. I just wanted to show you where the prostate sits in relation to everything. So it's a gland that sits just at the neck of your bladder. The bladder is a sac of muscle that contains your urine. So for men, the prostate sits just at the neck, and the main function of the prostate is to allow your sperm to have nutrition, to have lubrication, to help you have children. What tends to happen as we get older is that in response to the male hormone testosterone, the prostate gets bigger and bigger. And in some men from different ethnic backgrounds, this increase happens faster or slower. So the more melanin you have, the more likely your testosterone levels are higher, the more likely you will have issues of your prostate being too large, okay? And some of the symptoms that you may experience if your prostate is enlarged, we can have the next slide, please, is basically stopping the flow of urine from flowing freely, essentially. So you may experience that when you have the urge to urinate, you can't really hold it. You may experience that when you've emptied your bladder, you still feel the urge to go and empty it again very soon. You may even notice that when you go for a wee, your flow or your stream is not very strong, and you end up having a lot of dribbling at the end. You may even have to strain in order for your urine to come out. If we can go on to the next slide, please. And I'm just showing you a comparison between a healthy prostate, which you can see to the left, and a prostate that is enlarged. Again, this doesn't mean it's cancerous. It's just enlarged in relation to the male hormone testosterone. So if you're here as a man and you have any of those symptoms, one of the final ones is it tends to wake you up at night. So at night, you're not actually meant to urinate at night. But if you find yourself urinating at night more often, so twice, 3 times, 4 times, there might be an issue with your prostate. What we will encourage everyone to do, if you have any symptoms, as I've described, is to see your GP. You can see that the prostate is very close to the rectum. And so what a GP will do is fill your prostate through your rectum. Unfortunately, this is what stops a lot of men from going to their GP in the first place to have it examined. But trust me, it will save your life and make your life a lot more livable. One of the other things that can happen to a normal, healthy prostate is that it can get inflamed through infection or irritation. And some of the symptoms may be the fact that you're going to the loo more often to urinate. You may have like a sore, burning feeling in and around your testicles, in and around your back passage as well. And nothing really seems to help. Again, the GP will be able to examine your prostate and give you a course of antibiotics that should make that come to an end. Next slide. So we've talked about what can happen to the prostate if it is enlarged. It doesn't mean it's cancerous. It's just getting bigger in response to the male hormone testosterone. We've also talked about what can happen to the prostate if it is inflamed. Now, finally, we want to talk about prostate cancer. The first thing I would like to say is that every man, as soon as you hit the age of 50, along with a big birthday cake and a big birthday party, you should also book an appointment to see your GP. If you agree with me, say amen. We are still in church, so it's hard to get away from that. So as soon as you hit the age of 50, book an appointment with your GP. They'll do 2 things for you. The first thing they'll do is they'll ask you about your risk. So again, if anyone in your family, if any male person in your family, so your dad, your grandfather, or your brother has ever had prostate cancer, your likelihood of having prostate cancer is 3 times higher than the normal population. So you have to stay vigilant. Amen? I'll stop saying amen. So you have to stay vigilant. The second thing they will ask you is, are you having any of those symptoms? So are you struggling to empty your bladder? Are you struggling to not wake up at night to urinate? They'll also ask you about your erections. So one of the things that happens with prostate cancer is that it actually affects the nerves around your penis. And it stops you from being able to have good erections enough to penetrate and essentially have sex. So this may not be anyone's fault if you're struggling to enjoy your sex life in marriage. It might be a sign that you need to see a GP to have a prostate exam. If you ever noticed any blood in your sperm as well, this is another sign that you need to get your prostate checked. And then finally, if you notice any blood in your urine, we've had the kidney people come to talk to us. It may be your kidney. It may be the tubes leading from your kidney to your bladder. It may be your bladder, but most of the time, it's often your prostate as well. So for all those reasons, it's worth seeing a GP. After they've asked you those questions, what they'll do is they'll do a blood test called the PSA. So that's the prostate-specific antigen test. And they compare it to the normal population. So if it's high, all they'll do is they'll do an MRI scan of your prostate. In the past, they used to have to do surgery straight away, but actually now is a painless MRI scan. They'll be able to see your prostate and act on it. So again, there's nothing to be worried about. There's nothing to be scared about. It's an MRI scan of your prostate if it's high. The other thing they will do, because I think the society doesn't care about men too much, so the PSA is a very, very old test and is not very sensitive to picking up prostate cancer. So what they'll do is they'll also feel your prostate. You can see to the picture on the right, the prostate looks very lumpy. So when a GP feels your prostate, they'll feel whether it is smooth or whether it is very lumpy. If it's lumpy, regardless of what your PSA is, they'll send you for an MRI scan as well, and then they can act on it. Luckily, like everyone has said before, the earlier you get seen, the earlier it is detected, the less pain you have to go through in terms of treatment, in terms of management. So if you leave it off and it's been happening for a year, unfortunately, there are times where I'll be examining a man who's had these symptoms ongoing for about a year and a half. And by the time they've come to me, the cancer is in their bones, for example. So as soon as you get any of these symptoms, again, it's a 10-minute appointment. They'll feel for your prostate. They'll organize a relevant test. You may even need an MRI scan, but that will give you peace of mind, or it will allow us to act more quickly. Thank you very much for listening.
Thank you so much, Dr. Kingsley. Thank you. So that concludes our 4 speakers, okay? So there are 2 things we want to do now. We want to bring all the 4 of them to the front for a quick 1-minute questions that they can answer. And then after which, we will go to the floor where you will ask your individual personalized questions. So our speakers, please, if you can come to the front, Cancer UK, prostate cancer, breast screening, and renal disease, please come forward. And our audience, we will pass the microphone around for a quick fire question. We want it to be precise. We want it to be spot on, okay? Very neat and clean. And then after that, we will disperse to the back of the podium where we will do individual, more targeted information. So guys, any question you have, please feel free. Some people may not speak English. They may prefer a local dialect. I believe we do have somebody in the house that can translate the question they're asking, and we'll be able to quickly cater for you as well. Okay? Are we set? Let's do this. Okay, so we will pass on the microphone to this side. Anyone with a question you want to ask from the 4 speakers, I will pass the microphone around. Okay, please, they are at your service. You see them every day at work. You know, when you go to the hospital at the GP, these are the people you see. They're just in their house clothes. So please don't feel shy. Get that information for free. Anyone here? Anyone here want to ask a question? Anyone? It doesn't look like you know. What about this? Oh, thank you. Your name, please, and your question.
Ernest, MBB. Hello. To talk about the prostate, I want some. Do eating a pumpkin seed help with someone who's got prostate? Pumpkin seed.
So thank you very much for that question. Unfortunately, what happens with any issues of the prostate is that because of maybe our fear, there are a lot of rumors and old wives' tales about what can help and what can prevent it. Honestly, the answer is, if you're concerned about your prostate, go to your GP, get it checked out, get peace of mind. Whatever is needed to happen, whether it is cancer, whether it's just gotten a bit larger, which, like I told you, can happen naturally just as a result of your male hormone testosterone, or if it is just slightly inflamed, it is very treatable, it is very manageable. Unfortunately, what tends to happen is that the people who tend to live longer are the people who are not scared of their doctors, are the people who will go for any issue. But I think for us, because we will try pumpkin seed, we will try hibiscus tea, we will try so many things before we actually go to our doctor, and oftentimes it's too late. So my answer here would be, if you are concerned, that's for all of us here, about your prostate, just book an appointment with your GP.
Thank you. 2 more questions. Otherwise, we call. Oh, thank you.
If I keep on getting sharp pain in my breast, but there are no lumps, should I be worried?
So with breast pain, it's quite difficult, isn't it? Because as ladies, we do tend to have what we call cyclical pain, depending on in the cycle. Our hormones also affect how our breast feels. So if it's a pain that comes and go, we're not too worried. It could be just related to your hormone level and, like I said, to your cycle. If it's a pain that doesn't go away, even with painkiller, and any pain that kind of increases in intensity and stays, then I'd say do get them checked. Okay, it doesn't necessarily mean it's due to something sinister, but like I said, if it doesn't go away, then do get them checked, especially if it comes with other symptoms that I've mentioned, like changes in the skin, or you can feel something that wasn't there before, then get them checked.
Thank you. Any question for the renal team?
Thank you. I have a question about the kidneys. Is the color of your urine or the amount of water you drink have anything to do with the health of your kidneys?
Thank you very much for asking that question. Yes. So the normal urine color is straw-like. It's between white and then yellow, but really, really strong. So on the days when we do not drink a lot of water, and I'm using the word water, we would find out that our urine color is concentrated, so it really looks dark, and then the amount that comes out is small. On the days we drink a lot of water, we pass out more. So somebody has asked me, Roslyn, when you were in Ghana and when you are here, do you pass more urine here than when you were in Ghana? And then I said, precisely so. So being here, I pass more urine. Now, it doesn't mean I'm drinking more. But when I was in Ghana, it is hot. So I lose a lot of water through my skin. So I do not pass out a lot of urine. Here, it is cooler, especially around this time, cooler. So I am not passing a lot of water through my skin, as in sweat. So I would pass out a lot of urine. But let's look at the color of our urine, because it is a mirror of how well our kidneys are functioning. If it is foamy, so I like you asking that, if my urine is foamy, it means that there is a problem with my urine, and I need to go and see my GP. If it is red, as in there is blood in it, it could be a sign of prostate cancer, but it could be also another sign, especially for us women, if you are not menstruating, if you are not having your menses, and there is blood in your urine. Please don't just say, okay, it will go away. Go to your GP, get a test done. It is important. The earlier we find out if there is any problem with my kidneys, the earlier we can actually hold the problem with the kidneys function going away completely. Thank you.
Thank you so much. So that concludes our Q&A. Please have personalized individual questions. Thank you, our beloved audiences and our beloved speakers. We do appreciate you. You can now have your seat. And on this note, guys, we are dispersing you to get to the back and get checked. Okay? So, I've just been given a heads up, please. Oh, sorry, yeah. Apologies. We do have our dignitaries with us now that need to be acknowledged. So I will call on the president of the network, which is Dr. Chim. Dr. Chim, please come and acknowledge some of our guests who we have invited to be part of this event today. So Dr. Chim, the floor is yours. Thank you.
Go up. Okay, thank you. Thank you so much. It's been so empowering this morning. I've learned quite a lot. Definitely, it's a very good event, and we thank for our speakers. Thank you so much for your efforts and everything you've taught us. This time, I really just want us to formally acknowledge Her Lordship, our Mayor, Councillor Donna Lumsden, for coming to us. And if you'd like to come and just say a few words to us, please. Yeah.
Hello and good morning, everyone. Once again, good morning. I'm a little bit tired. It is a pleasure to be here today for the London North Public Health Awareness and Wellbeing event, which promotes awareness and educates our communities on common health problems and general well-being. In Barking and Dagenham, we have an important slogan: one borough, one community, and that is why organizations such as this one are so important, as they come together to educate our community and promote physical and mental health awareness. Events such as this one also promote social cohesion. A social cohesion society is one which works towards the well-being of all its members. It fights exclusion and marginalization, creates a sense of belonging, and promotes trust, which is at the heart of the LBBD Council. Our corporate plan message is, no one is left behind, and that is exactly why organizations such as these are so important to Barking and Dagenham. I would like to congratulate the organizers and team here today, and I wish you every success for the future. Keep up the good work for our community. Thank you so much.
Fantastic. So that's very well done. And thank you all for such a presentation. So guys, the floor is now yours. You can now get to the back and see your healthcare professionals for your individual screening. We are here to help. So all of us, most of the people in red, they are all healthcare professionals. Doctors, pharmacists, advanced practitioners, specialists, nurses, specialists, doctors. So please feel free. They will be able to give you one or two information, okay? So the floor is now yours. You may disperse. Thank you. So guys, as we do this as well, don't forget we do have our counseling session. I've announced it earlier on, but we do have our counseling session, which is in the room next to where the blood pressure screening team are. If you are somebody that have anything that's not health related, you want any spiritual counseling or anything to do with your faith, whatever that you want to do, we do have a room there as well, and that will be spearheaded by our very own Apostle George. So please feel free to dip your hand in that one as well to get the full package. The mental health team will screen you first, and then after that, they will pass you on to him where appropriate. So please do not forget that. Thank you.